Today, I'd like to welcome Dr. Sunny Nakae, UCR School of Medicine's Associate Dean for Student Affairs. We're going to be discussing students coping and adjusting to the COVID-19 pandemic. Welcome, Dr. Nakae. It's such a pleasure to have you here with us today.
Hi, thanks for having me.
So I wanted to ask you, schools and academic institutions were closed quickly when this pandemic began. Were teachers and professors prepared to begin teaching their lessons online? And if not, what is being done to ensure that teachers and professors can navigate through online platforms to resume their teachings?
I think this has been such an interesting turn of events because while we did a lot of online learning and the use of online platforms in the School of Medicine, we were not fully prepared to just move everything online. So I think, we had some of the infrastructure there, but some things especially in medical education, really cannot be easily adapted. So some of the didactics, for example, where you have to actually perform a physical exam on a patient actor, those things are really, really hard to do online, if not impossible. So some things had to be postponed. Some of those types of exams where we would observe students doing specific skills. But for the most part, we were able to move a lot of our lectures into an online format. And, some of our online learning platforms worked quite well. I do think for my children who are high school and middle school age, those goals were really caught off guard. So learning completely shut down in our school district for 2 to 3 weeks, and then they didn't really relaunch anything until almost a month later. And then due to some of the inequalities around access to online learning, they weren't able to make it heavily structured or mandatory or have time constraints around when students engage. So I think at the collegiate level, a lot more preparation was in place because online learning is much more customary in those formats than at the middle school, elementary, and/or high school level.
So are schools and academic institutions providing materials to ensure that every student has the resource they need to receive an education during this time?
Yeah, so one thing that we're in Riverside Unified School District, my children, and one thing that they did immediately was open up a technology resource hotline. And so they tried to provide, laptops or loaner devices, have a hotline if people were having a hard time using the interface to help families. And they did that in both English and Spanish. So I think, I was pretty impressed that relatively quickly they tried to get these resources up and running. I think it's challenging because public spaces are closed and not everyone has Wi-Fi in their home. So I did hear that companies like Spectrum were trying to respond to that and offer, free Wi-Fi for a certain period of time for families who were trying to engage education from home. One of my colleagues, my friends in Chicago, is a CEO of a charter school network there, and they actually shipped devices, tablets and hotspots to every single one of their kids in order to ensure that they could continue with the online learning process. So I think, school districts have been able to respond in varying ways. One of my daughters attended a private school here in this area that was just in our neighborhood. And it was very small. And due to the pandemic and some of the challenges they were having before the pandemic, that was just the straw that broke the school. And so they're officially closed. Like they were a school for 30 some odd years. And the last day of instruction was March 30th. So we've been trying to put together curriculum, on our own for that child. But I do think that there are going to be big challenges in figuring out resources if this becomes, social distancing is in place. And so obviously, funding is different. We're not maybe paying for building maintenance, and some of those funds might have to be reallocated for technology to give students the support they need.
Wow, that's serious. I think there's a lot of families that are experiencing those same issues.
Yeah, and I think for college students, UCR is great for the resources that we typically have on campus. There's like a laptop checkout in the library where you can just go up to the machine and check out a laptop we tried to provide a lot of those resources, including obviously Wi-Fi and things like that. So for students who were commuting from home, they might not have quiet spaces to study. So it's not just about, materials and the technology, it's also about place, place where people are. My partner is a student at Riverside Community College and was adjusting to being back in the classroom after many, many years. And then it went to online learning. So then he had to adjust to a whole new platform. And I can imagine for a lot of people, it was not very comfortable. And one of the students in one of his classes shares a tablet with 6 people in the house. And they're all trying to sort of do online learning through this modality, and it's just not ideal. So if she's not able to get the tablet, then she joins the classes just with her phone. So, a lot of people don't have a good data plan, and there's been some significant challenges with just both place and setting and the resources, the infrastructure, as well as like devices and things like that.
What do you believe will be the impact of students not having formal instruction for months, or having this, online version where they don't have access or don't have the resources that they need to be able to, continue a formal education?
So this is greatly concerning to me, just because we know in secondary education, we call it the summer melt. So kids will typically lose a lot of their academic stamina, as well as the retention of some of the knowledge, particularly in math, over the summer. And so a lot of districts, for equity reasons, move to year-round school, where the longest break that students ever get is sort of summer vacation is sort of distributed across the year. So the school days are the same, but there's not a big, long, moratorium on learning, because kids have different degrees of structures and resources in their home. So this has just really thrown that into hyperdrive. So for many students, the lack of routine, getting out of the habit of learning, not having access to books, because not only is school closed, but libraries are too, right? So if you're not a family that can afford to have books or purchase them, then you're really at a limited resources for trying to get reading and home learning done. So I think that some of the educational disparities that we already see that are products of some of the structural injustices around income and place and resources, like we talked about, are just going to make the disparities and achievement gaps that much greater for students who come from low resource backgrounds. So I think it's definitely challenging, particularly for students who already have learning challenges that are being accommodated at school. If they have attention challenges or learning disabilities and are relying on individual educational plans, those IEPs that school districts are required by state law to provide, I don't know that it's reasonable to expect all the school districts to provide those IEPs in the homes of all those, kids during the pandemic. They don't have the staff to do it. So it's going to create a wider gap because of the resources and some of the challenges. And for me, it's really concerning, because at the medical education level, we are the recipients of students who come through the K through 12 system and the undergraduate system. And so our sort of, where we go to recruit our students are from those who are at the college level. And so if fewer students are making it through the K through 12 system due to those disparities, that affects ultimately the physician workforce and the health of the whole country. So that's a very long view, but I do think that there's going to be a pretty disparate impact because of the loss of school.
Yeah, I agree. What resources are you aware of that are available for students who are feeling stressed and isolated during this pandemic?
Yeah, so a lot of our students are using, in terms of just their own wellness, like a lot of apps have gone to free access during this time. A couple of the things that we're using, and most of them are coming through a computer portal. So that becomes the challenge. But I do know that there's a website called No Red Ink that is offering it's a subscription based for teachers and parents, but they're offering more instruction and more modules, and they have grade level based grammar, composition, writing, kind of tutorials type stuff, quizzes that you can do. So my children have been doing that. Khan Academy has been really helpful in releasing daily schedules based on specific grades. SalCon, if you go to khanacademy.org, SalCon has a message up talking about homeschool and what they're trying to do to curate more content. There are quizzes and interactions, and like it comes in little, 10 to 15 minute segments, educational videos that you can watch that are all very reliably fact-checked and things like that. So that's a big resource that's also free. Parents can create a parent account and associate their children's accounts with that, so you can actually look and see what your kid is doing throughout the day and how much time they're spending in each of those modules. It adds a little bit of accountability, which I think is important. When you're a kid and you're on a computer, it's really tempting to just go and play games. I mean, I think for all of us, it's tempting in terms of staying on task, but some of those online learning platforms have been helpful. And then the apps that are great for things like yoga or doing your own PE at home. There's an app called Down Dog that will customize a yoga practice for you. They also have a couple of them for like HIIT training or cardio. The Peloton app is free until September, I think, or it's like 90 days free. And they have also yoga, meditation, and it's based on how much time you have. There are some family workouts on that one that are good. So the resources are out there. A lot of Facebook groups are also posting free like online tours to museums, virtual tours to different places around the country. There's been a kind of a flurry of resources to help people who are trying to learn at home.
What are some practices that can help students maintain structure and organization for their studies during this time? You mentioned Khan Academy and some other apps that are very useful. I've actually used some of those apps for my daughter as well. Do you have any other resources that you can share?
Well, I think an important practice is to still try to maintain a school schedule. So get up in the morning as if you have to go to school, right? Or work in our case. Get up at the same time every day like you would if you had to catch the bus or, get a ride to school at a specific time. And do a daily schedule. So because you're not doing passing periods and things like that, they do recommend 3 to 4 hours of actual like online learning time. That's about equivalent to what you're getting during a school day between all the different transitions and divided attention. So if it's just you learning at your own pace, 3 to 4 hours a day is good. Taking breaks is good. So if you're saying, I'm going to do an hour of learning and then I'm going to take a 15-minute break, I'm going to do another hour, another 15-minute break. Put in PE. Physical education is important, and there's a lot you can do with no equipment at all. If you can walk in your neighborhood with a mask on, that's great. There's also simple things like jumping rope, or again, a lot of those apps have like boot camps and different exercises that are kind of push-ups and sit-ups and running in place, or different exercises that you can do without equipment. So I think the physical activity is important to help sort of break up the day. And then put in some fun things in your schedule if you can, and you have the resources to do it. That might be like arts and crafts or free reading for at least 20 minutes a day. Cooking, my kids have started cooking a lot more, which has been fun and adventurous in many ways. So try and find some things that you might be interested in doing at home that you wouldn't be able to do at school. If your parents have any specific skills, maybe in building or something to do with automotive or something to do with their careers or their jobs, find out what they're doing and see if you can incorporate an elective in your homeschool schedule to learn something new.
What strategies can incoming freshmen use to ensure that they are prepared for their transition once campus activities resume?
Yeah, I think that's going to be really challenging as we're still trying to figure out what orientation is going to look like with social distancing and so much of it being online. I think learning everything that your college has to offer, whether you're going to be engaging a socially distant semester or not, is important. So figuring out what resources are there. Is there a writing center? Is there math tutoring? What do the counseling and psychological services look like? And how are these services going to be delivered in our socially distant reality due to COVID? So learning about the resources, I think, is good. Making sure that you're prepared and that you know how to access those things. Trying to think about what types of learning you'll be doing, so that, for example, if you need to use a tablet or a Chromebook or a laptop, figuring out how to prepare to have the right technology for online learning, I think is probably going to be important as well, to the extent that people are able to do that. And then I do think that some of the, meeting new people and some of those experiences for college are going to be a little bit challenging, because normally you would be on campus or in a classroom and, kind of be able to talk to people. So I would say, be prepared to sort of get outside your comfort zone, and maybe if there's an online social, like, just go, right? It might be uncomfortable. And, as I've been working with the medical students, a lot of them are, not wanting to get on Zoom and do a Netflix watch party or something, but we all need that connection. And so there's ways of doing that in a socially distant reality that we're living in.
Okay, well, the online environment has resulted in a lack of motivation for many students. Or what can be done to change or mitigate this?
So I think reaching out to your peers and seeing if you can have a meetup once a day, right? Like, maybe everybody tries to synchronize their lunch hour, and you jump on a Zoom call or Google Chats, and just, connect with your friends and really look forward to that, saying, okay, I'm going to do my online learning. Then I'm excited to go and, do something with friends. There's some games that you can play over Zoom. My children have played Guess Who. If you have the same version, you can play that. You can play Battleship. Pictionary is fun to play via video. So there's some kind of social things that you can do. You can also have your friends join in your learning community. So you can create a class, for example, on typing.com. So my kids have also been trying to work on typing, and there's games. So you can race each other to see how fast you can type. Like, the faster you type, the car goes. And so you can engage in some, like, friendly competition with friends to keep up on your learning, or maybe try to do the same modules in math and Khan Academy, and then discuss it together and see who can get, like, the highest score on the final quiz. So some of that sort of reaching out to other people while you're doing learning can help with motivation, because a lot of what this is sort of the classic of, like, why does Dr. Nakae not work out at home? Because I need the social motivation of the gym. So I've been struggling to sort of keep up with my workouts, because I really enjoy the social aspect of going and talking to a trainer, or seeing the people that I typically work out with. So it's the same with our learning. Like, we are very social creatures. And so trying to reach out across those lines and create some of your own learning communities, if you have chat forums or again, platforms that allow you to create a class or a subgroup, that can also be really helpful. I also recommend that students start their own book clubs. I think that's a great strategy. If there's a particular genre that you like to read, reach out to some friends, or maybe do a survey of your class, like, who's interested in reading this book, and maybe it's one that you can get, used and really cheap. And try and see if everybody can do a common read and get together and discuss the book once a week. I started a book club with one of my friends, and it's been something kind of fun to look forward to. And then I kind of have an assignment, because I have to, keep up with the pace of the discussions. So the more we can try and reach out and connect with others, I think that actually also helps with motivation.
Thank you. Okay, quarantining has led to feelings of loneliness and isolation for many students. What other coping strategies would you recommend in achieving healthier and a happier experience for students who feel disconnected?
Yeah, I think this is really challenging, especially for students who are very, very social by nature, and who really are kind of our extroverts. I think, making sure that we connect with our friends over various platforms is helpful. I do think that exercise and diet play a role, because we know that those things both affect our mood. So some of those wellness habits, like going to bed at a reasonable hour and waking up at a reasonable hour every day, also help with our brains and our moods. Having a healthy diet, my daughters and I were joking that we don't eat as healthy of lunches as we used to, because we're at home. And so when you're leaving the house in the morning, you have a high degree of intention about planning what you're going to eat and making sure that it's very balanced. But when you're just refrigerating all day long, you tend to not be as thoughtful about what you're eating. So I definitely think continuing to pay attention to, sleep and the stress management pieces. There's some really great apps out there that have free stuff on meditation. I mentioned a few, but also I think Breathe is one of them. There's Calm, there's 10% Happier. So there's several like strategies for guided meditation or different types of apps that are meant to also help with the mental health side of it as well. And I should also mention a lot of school districts have still their counseling folks open. So if you could reach out to your school and just schedule a chat or a check-in with your school counselor, that might be an option. For college students, the counseling centers are still open as well and are doing, telehealth or, telecounseling visits with students, making that really accessible. So I think that's a good strategy, because this is bringing up a lot of feelings. I mean, this is not really normal. We're at home under very different circumstances. So trying to actively cope with those strategies is good, and turn off your Netflix and go to bed at a decent time. I have not always done great at that either, but I'm always glad in the morning when I have gone to bed at a decent hour and I'm waking up with my regular routine.
It's nice to know you're human.
Yes, I was just loving, I was watching Schitt's Creek and I just could not. I was like, okay, just one more episode, because they're so short. And then I'd be like, oh my God, it's like midnight. I need to go to bed. Like, this is so bad. So.
No, but you provided some really good resources. I wasn't even aware that the counseling services were still available to students. So that is a huge resource that I think most families and just most students in general should access.
Yeah, absolutely. And just even doing your own group chat, just check in and have a wellness theme. Like, let's everybody talk about like, what you're eating and do a recipe share. I mean, you can do it without having it framed as counseling, because really counseling is just, being able to bring our entire self into the room. And so if you have a safe group of friends or a family member that you can reach out to and do that with, that really helps us to be seen and feel known, and helps with some of the isolation that we're feeling.
Okay, that looks like that concludes our questions that we have for you today. I just want to thank you for lending your expertise as a professional in the academic world, but really also for sharing your personal perspective just as a mom. You have really shared some valuable practices and resources that I know will be helpful for our listening community as well as our students. And hopefully this will help them be able to thrive during this time, because I know it's a difficult time for all, but specifically for our students, I want to, and you already have, so I thank you so much for allowing us to be able to interview you, because you have definitely provided a plethora of resources that I think are going to be very valuable to our students moving forward. So thank you again.
Well, it's a pleasure to be here, and I wish everyone the best. I know these are trying times, and just encourage people to continue to reach out and do your best every day, and that's going to change based on what's on your plate. So I know that we all need to give ourselves some compassion and grace during this time as well, and just hang in and keep reaching out to each other. So take care.